I'm Joseph Montgomery. I'm from Pontotoc, Mississippi, youngest of 3 children. My brother was 18 when I was born. My sister was 14 when I was born. So wanted to be a doctor for a long period of time. And my brother's a doctor, so I grew up with him, watching what he did and following him around at work. And I got to see firsthand exactly what he was able to do. People would come to him that had been sick for many months, and he was able to help them with giving them compassionate care and just appreciation that they showed for that. I did medical school at University Medical Center in Jackson, Mississippi, and then went to family medicine residency at North Mississippi Family Medicine Residency Center in Tupelo, Mississippi. My philosophy is just to provide compassionate care that focuses not only on the treatment of chronic medical conditions, but also the prevention of them. Prevention is always extremely important. If you can always prevent a disease, you're a lot ahead of the game than if you do not. As far as when you develop a disease, it's something you will have for lifelong, and you can treat these diseases, but they are, most of the time, you're not able to cure them. So any way we can prevent these diseases is always at the top priority list for us. There's a lot of times I don't get a chance to do a lot of things outside of work. I work long hours a lot of times during the week. When I get home, I always like to spend time with my family. And also, during the weekend, sometimes I will play tennis and have some sort of exercise that I'm able to do. My main goal is to improve the health of the overall community just by, providing high quality, evidence-based type care. You have a job, you want to come to it, you want to be able to help somebody, you want to be able to make a difference in someone's lives. That's really what makes it worth it. There's a lot of things that you can do if you're just, like you said, just to make money or just to do that, but to actually come and have an impact on someone's lives is what makes this really all worth it. I came to this clinic and interviewed. It's one of those things where you felt like you knew these people for a very long period of time. It just really felt like an extremely good fit. And it's just one of those things it's hard to explain. It's just you got there and you felt like, this is where I'm supposed to be, and that's just what really drew me to this clinic. A lot of times, like with heart attacks and strokes, a lot of times the beginnings of that starts early in our life with high cholesterol, high blood pressure, things of that nature. If we can treat that earlier, then we can a lot of times prevent these types of things, like heart attacks and strokes. I like to provide compassionate care that focuses not only on the treatment of chronic medical conditions, that also focuses on the prevention of them. And this is a place that I feel like is home, a place that I enjoy coming to every day, and that it's not a job to me, but is a mission in my life.